What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, having a great day, and testing negative for all those viruses. It is time now for the Tuesday edition of the Virus Update for Tuesday, August 5th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and yes, even though it's summertime here in the U.S., it's not summertime all around the world. Places like Australia, New Zealand, it's wintertime there right now. And even though it's summertime here in the United States, we are still dealing with a new wave of COVID that started up on or about a month ago. And I would say we're maybe about at the halfway point of the summer surge, which does continue to rage on and in some states is really bad. Want to stay informed with this? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Already, we do have some things to take a look at today. We're going to be starting off a little bit different. We're going to do one little news piece, which is the Post. Then we're going to take a look at some CDC data in relation to this. Then some other news stories and data, weekly updates. And we're going to take a look at some other data as well, such as air quality, which is really bad in some areas. And of course, we have weekly Pennsylvania data, New York State, wastewater, and I do have a little bit of an announcement at the end of this video. All right, starting off with this from Sci-Fi. The CDC reports COVID emergency department visits for ages 0 to 11 years old are highest in at least a year and spreading to older age groups in Hawaii, in Florida, at the highest level since August 2022 for Florida. In Texas, the highest level since September 3rd. And California, the highest level since September 9th. And that should have not said August 2022. That should say for Florida, August 22nd of last year. So all this, we're referring to dates from last year, not 2022. So in other words, 2024. And take a look at here. These charts continue to go up. Things continue to get a little bit worse when it comes to emergency department visits. But again, I should mention, it's very important I mention this, we are not seeing what we saw last summer. Yes, things are going up, but we're not to the point that we were last summer. For example, take a look at Florida. You can see here, it's going up and it's hidden a little bit. But look, we're not all the way up here where just about 4 to 5% of all emergency department visits were for a respiratory virus. We're up to about 2%. Could we hit 3%? Sure. I don't think we're going to hit the levels of last summer unless this wave decided to extend itself longer. We'll just have to wait and see what happens. So with that in mind, let's take a look at what's going on with emergency department visits in the United States. And you can see here, they do continue to go up. Let's take a look at some of the states. Normally we would show this at the end of the video, but I figured let's just pair it together. And we're just going to randomly go through the states here. The United States is still rising. Alabama's pretty bad. Alaska's not that bad right now. Arizona's getting worse. Arkansas is rising, as is California, Colorado, Connecticut, Delaware. Delaware is actually starting to rapidly rise at the end there. That's not good. Washington, D.C. is going up. There's Florida. Florida's really bad. Georgia is getting worse. Not to the point of Florida yet. Guam has gotten a little better. Hawaii is really bad. Idaho, not doing too bad. Illinois is going up. Indiana is going up. Iowa, Kansas, Kentucky, Louisiana, all going up. And Louisiana is doing pretty bad. Maine, flat at this time. Maryland's starting to go up more, as is Massachusetts. Michigan just slightly going up. Mississippi starting to go up faster. Montana's not doing bad. Nebraska's going up slightly. Nevada is going up. And we see New Hampshire is dropping some. Actually a little bit of a leveling off at the end. New Jersey's starting to go up faster. That's not good. New Mexico is somewhat okay. You are rising. Now it leveled off a little at the end. New York is starting to go up. North Carolina is going up. North Dakota is flat. Ohio is rising. Oregon is rising. Pennsylvania is rising. Rhode Island, okay at this time. South Carolina is going up. South Dakota is not doing bad. Tennessee is rising. Texas is starting to get bad. Utah also starting to get worse. Vermont is just up ever so slightly, but again, Vermont's not bad. And Virginia's going up. Washington has gone up some. West Virginia has gone up some as well. And Wisconsin has started to go up. All right, moving on now. This is the PMC update from Mike Horger and his PMC dashboard. 1 in 95 actively infectious. This was reported on August 4th. yesterday. And you can see the forecast here. Take a look at this. It is expected to continue to grow. So the number of infections is expected to go even higher. It's sounding like we may get to near 500,000 infections a day, according to his model. Yeah, that's not good. Look at that. You can see it here. It's projected that we will get near 500,000 infections a day, and then, who knows, it may go even higher than that. And take a look at this. Texas, Alaska, really bad on this map at the very high levels. Also high in California, high in Florida, Louisiana, Kentucky. Also Delaware now is going up high, as is Alabama, but we're not seeing the very high levels there that we're seeing in Texas and Alaska. Also Hawaii as well is also listed at this maroon-shaped, very high level. All right, moving on now to this. Get this. Spillovers from public health policies in schools, evidence from COVID mask mandates. What are we talking about here? Well, this is basically telling us that because we removed masks in schools, it contributed to an additional 21,800 COVID deaths. And no, I'm not talking about 21,800 kids died of COVID, but because the mask mandates were removed, they're saying that, well, because they were able to get COVID, they brought COVID to their household. Maybe an elderly person got COVID, or someone got it severe, and, it caused a death in the family, and this could have been prevented. Yeah, that's something really interesting. I'm going to make sure you can read this whole thing. There will be a post today with today's news stories, but yeah, if masks were kept in schools, again, as I say, I'm not here to enforce you to wear one of these N95 masks. I'm just guiding you into something that maybe you want to consider doing. But when we were doing this in schools, the masking, it was actually working to prevent some deaths. All right, moving on. New Zealand, this is from Dennis the COVID Info Guy. New cases, 632 new cases. That's up by 11.8%. Reinfections, 395, or 62.5% cases. Deaths, just 1. Total deaths, 4,749. That's up by 1. In the hospital, 69. That's up by 23.2%. 62.5% were reinfections. Sadly, 13 deaths were reported today. 1 is attributed to COVID, 2 not COVID, and 10 are not available at this time. Taking a look at what's going on with COVID in Italy. 1,312 cases in the last 30 days. 42 were among healthcare workers, and 62 years old is the median age of cases in the last 30 days. 49% of the cases were males, 51% are females. 11 deaths in the last 30 days. 659 recovered in the last 30 days. India reports 224 active COVID cases, and they do not report any new deaths today. Now moving to some good news for one state. CDC data for Connecticut has highest measles vaccination rate in the country. The percentage of Connecticut kindergarten students that received required measles, mumps, and rubella MMR vaccine in 2024-2025 school year is, get this, 98.3%, according to the Connecticut Department of Health. That is really good compared to some states that are just much lower than that. Way lower than that. So that is some good news. Also, looks like Texas at this time, the total number of measles cases there is 762. I believe that is the same number. 718 of them are unknown or unvaccinated. 1 dose of vaccine is 23 cases. 2 doses of vaccine is 21 cases at this time. All right, taking a look at what's going on with the viral activity levels in Canada. COVID-19 is low, flu A is low, flu B is low, and RSV is low at this time. Alrighty, we still have air quality alerts ongoing in portions of the Great Lakes and the Northeast. The wildfire smoke, it's really bad. It's really hazy outside here in Philadelphia today. Kind of hard to see the sun this morning. There were some clouds mixed in, and now I believe the clouds have broken up, but just the haze alone from the smoke, you can smell it in the air outside. It is not good. It is a good idea to keep your air purifiers running. And with that, I got to show you something that I just got in the mail here, a little package. I got some new filters, HEPA filters, for my air purifier. Yep, this is the actual filter. You can see here. There's another one. There's 3 filters that go in there. And then they also give you 4 pre-filters, which you can change every so often. And tomorrow you will see a tweet that I'm going to do later on when I change this. You will see the difference between the new filters and the old filters, and you will clearly see why I'm changing the filters, especially the pre-filter. Oh my gosh, yeah. Wait till you see that. You'll have to wait till tomorrow. I will hopefully show you that. I don't know. It's pretty bad. So taking a look at this now, air qualities, and I need to zoom this out before we refresh this. Let's take a look at what's going on with the air qualities across the country, and right away you can see the Great Lakes and the Northeast. The reds and the oranges continue once again, but those aren't the only areas with problems. There are problems out on the West Coast as well, as wildfires are affecting a large number of people out in the West. Yes, this is not good. Take a look down by Los Angeles, San Diego, also portions of Colorado. So yes, we have to keep our eyes on that as well. Again, anyone in these areas with wildfire smoke or active wildfires, please take it serious, especially if you have COPD, asthma, or any type of breathing issue. Pinellas County, Florida does have quite a few calls right now, and sick person is 1, 2, 3, 4 of those calls at the moment. Taking a look at what happened in Philadelphia on Monday, if we can. I've been trying to refresh this all day. There we go. Finally, an hour ago, they posted the total for Monday. 807 EMS calls were reported. Very busy right now in Montgomery County. They are up to 17 calls at the moment, and we can see respiratory emergency showing up not once, not twice, not 3 times, but 4 different times. So that is not good to see. Taking a look at what is going on in Chester County, Pennsylvania, yes, a few calls going on there as well. And in Bucks County, Pennsylvania, as of the last time I refreshed this, they had 11 active EMS calls. Let's refresh this again. Well, now 11 has become 12. We can see chest pain showing up a few times and a few other things going on. So, yes, busy day for EMS. Pennsylvania hospitals at this point are still dealing with busy conditions in the Lehigh Valley, which basically means Easton, Allentown, and Bethlehem, Pennsylvania. And there is a big music festival going on in that area. It will be interesting to see if wastewater shows anything there. I don't know. Do we have any wastewater sites there? Unfortunately, I don't think there are. Speaking of that, it is Tuesday, which means we can take a look at what's going on with Pennsylvania wastewater, and we can see here that the XFG variant in Pennsylvania has taken over once again. I don't know why LP.8.1 was leading the way last week. Really strange how that had happened. Taking a look here at what's going on with the statewide COVID levels in wastewater, and yes, Pennsylvania COVID wastewater levels are going up, and if we do go over this number 3, that would mean we hit moderate, and I'll tell you what, we're not far off from that number here in Pennsylvania. Taking a look at Warminster, Bucks County. Remember, this site was seeing a big increase. That increase has slowed off a little bit, actually dropped a little bit this week, but if we zoom this map out, let's see here, let's set it back to the statewide level. Well, it's not letting us do that, but there are a few areas that are starting to get into the high category. I believe Harrisburg may have been one of them. We'll take a look at Harrisburg. Yeah, take a look at this. Harrisburg now is, no, they're getting close to moderate. I'll show you Harrisburg on WastewaterSCAN in just a little bit. Also for Pennsylvania, and then we're going to move on, emergency department and hospitalizations. And we can do that for COVID. And you can see here, let me scroll this to the right. You can see here, hospitalizations now up to 172 in Pennsylvania. Even pediatric hospitalizations are starting to go up. Yeah, that's concerning to see more kids go into the hospital for COVID. Here we are in 2025. 172 adults in the hospital and 11 kids in the hospital at this time. New Jersey, taking a look at the hospital situation there. Not all that bad. There's just one hospital dealing with a problem. Robert Wood Johnson University Hospital has a divert at this time. Yeah, nothing else to report from New Jersey. Taking a look at what is going on with the Walgreens positivity rate, it's up to 33.5%. It has continued to go up. It has actually gone down in a couple states, though. Mississippi, 30%. Alabama is at 19.5%. That's a big drop by 9.1%. Hey, there's actually a few more. Wisconsin, 31.3% positivity rate. And Colorado is at 20% positivity rate. All right, take a look at this. 376 new cases reported in New York State. The overall trend continues to go up. And let's take a look at what's going on with the statewide hospitalizations. you can see it did have a big increase today, up to 357 with 34 people in the ICU. And when I say big increase, big for 2025 standards. Now let's take a look at a couple different regions. You're going to see New York State and go, well, or excuse me, New York City and go, well, wait a second here. New York State just went up. Why did New York City go down? It's true. New York City actually dropped a little bit today. 156 people in the hospital, 9 in the ICU. But when we take a look at Long Island, you'll see Long Island did have an increase today. They went from 60 people in the hospital to 67. I believe Western New York was another area that went up. Yeah, Western New York went from 6 in the hospital to 15. What happened in the capital region? Didn't that go up? No, capital region went down today. I know there were some other regions that also went up today in New York State. Yeah, there you go. Mid-Hudson went up to 39 people in the hospital. Before it was 31. You get the idea. So New York City dropped slightly today, but because a bunch of other regions went up, that's why New York State hospitalizations overall are higher today. All right, let's take a look at some wastewater sites, starting off in Hawaii. And we can see here that Honolulu, take a look at this, 390,000 population at this wastewater site. COVID is running high. It's all the way up to 800 pathogens being detected. Also, norovirus is running a little high at this wastewater site as well, which is not good. Let's go back to the lower 48. As promised, we'll take a look at Harrisburg here. I think this is going to show Harrisburg running high. Yeah, Harrisburg is high and continuing to rise at this time. Just maybe a little bit behind now that we're at August 5th, and Pennsylvania itself did update today. We'll have to see what this site shows on WastewaterSCAN in the coming days. But again, COVID high there in Harrisburg, Pennsylvania. Let's go back out to the West Coast because we spent so much time in the East. Salt Lake City. Take a look at this. In the Rocky Mountains area. High and, well, continuing to rise for COVID at this time. Yeah, that's not good. Your levels continue to go upward. Let's take a look at what is going on in Snohomish, Washington. Is that? Yeah, Snohomish, Washington. Let's see what's going on there. We see your wastewater level for COVID is medium. Do you have any other problems going on at this time? No, but norovirus started to go back up just a little bit, so that's something that we will have to keep our eyes on. Let's go to somewhere in the Great Lakes now. Let's see what's going on. How about we go northwest of Chicago, Glen Elwyn, Illinois. Did we not have a measles detection here? Or we had something here. Well, hepatitis A is being detected there at this time. COVID is still low, which is good to report. Let's take a look here. Let's go back to the national. Let's go to the measles. I think the only measles, no, we do have two measles. One in northern Idaho, and there's another measles detection in central Kansas at this time. And how about Mpox? Are there any detections of that? That's what it was. Yes, there was a Mpox detection in Wheaton, Illinois that I wanted to show you today. And take a look at this. You can see here, actually two detections of it now. So that's rather interesting. It's obviously something that we are going to have to keep an eye on. Alrighty, I got to share something with you before we end today. Take a look at this. We set up a new Data Report fan club on YouTube using the YouTube memberships. If you've seen other channels, some do it. YouTube's been sending me emails about this for the longest time, and I was always against this idea. I was like, no, that doesn't sound right for the cause, for the type of videos that I'm doing. But then I started thinking about it. You know, as of lately on weekends, I've been doing recording early videos, and maybe sometimes on random weekdays, I'll be able to record my videos early. Well, for days that I do that, you can, if you become a member of the channel, you will have early access to the videos. Why don't I post my videos early in the morning? Because the algorithm just does not like that. I've tried it time and time again. I said, you know what? I'm going to post today's video early. I'm going to be done for the day. And yeah, I've done that a few times. It's like, okay, YouTube just doesn't like that. Yeah, nobody wants to see this. I don't know why the algorithm doesn't like that, but it's accustomed to me doing between 2 and 5 p.m. on weekdays, and then Sundays around noontime sometimes do work. So if you want to get early access to my videos, I have it set up where it is $5.99 a month. I mean, it's basic. I'm just doing one level. They say, oh, you can do 2 levels. 3. No, not doing that. You also get priority access replies to comments. In other words, I'll reply faster. I'll make a point of it, and plus I'll do some member-only shorts, and maybe once in a while a member-only video on like how my health is doing with long COVID, rather than clutter up one of my virus updates with how I'm doing. I'll do a member only once in a while, or maybe a photo status update. More so, forget about that. More so, the big thing is you'll have early access to videos at least 2 times a week, maybe on rare occasions 3 times a week. Does that seem fair? Because if I post my videos early in the morning, it just does not work with the algorithm. I don't know why. But for those who want to see it earlier in the day, just become a member. It'll be $5.99 a month. And if you don't want to become a member, that's fine too. I do not care either way. Alrighty, folks, that does it for today's virus update. Hit the like button if you like today's video. Subscribe down below if you're new. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And if you do want to become a member, just go over to the homepage of the channel, click on membership, and it will come up and it'll tell you all the different little things that are there. I will see everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Tuesday afternoon, and thanks for watching.